Welcome to the University of Michigan Dentistry Podcast Series, promoting oral health care worldwide.
This patient was referred to us with a chief complaint of pain in the right joint. She is somewhat unique in terms of this complaint, since she is a music student playing a clarinet, and sometimes we have problems with instruments causing TMJ disturbances. In this particular patient, there are additional problems related to a tooth, a molar, which is apparently dying and is causing pain, which makes her trapped between a painful joint and a painful tooth, and keeps her oscillating between one side of the jaw and the other. How long have you had this complaint?
Well, the jaw has been bothering me since June, and the tooth, I guess, about 2.5 months, 3 months.
Is the joint painful all the time, or just when you move it?
Just when I move, when I play and when I eat. And if I'm lying on my front or something like that, it's painful.
Have you had any treatment for this?
No, I have not.
Does anything relieve it? Any type of medication, aspirin?
No, I tried aspirin for a while and it didn't seem to have any effect.
Is this the only episode that you've had of a painful joint?
Well, 3 years ago, I think I damaged the tendons or ligaments, whatever is there, eating very hard granola.
Did you have a sudden pain then when you were eating?
Yes, it was very suddenly painful, and after a few minutes it subsided to a certain degree. It seemed to heal up and come back every once in a while until June, when it stayed.
Does it bother you more at night or in the morning?
It seems to bother me after playing my clarinet or during playing it, especially if I'm tense. Concentrated hours of playing.
It doesn't keep you from playing the clarinet, though?
It doesn't stop me from it, no. I wasn't playing when it hurt to the extent it did in June, when I couldn't open my mouth very well, I think.
Let's see what kind of motions caused the pain. Would you open, please? Is this as wide as you can open? There's some limitation of opening. Is it tender over the joint? A little bit.
Mm-hmm.
Over the right joint. Mm-hmm. Would you move your jaw towards me? Does that hurt to move it in that direction? Move it in the other direction. You can move it farther that way before it hurts. Is that right?
Mm-hmm.
Mm-hmm. Okay. Close your teeth together. Squeeze hard. Does that hurt? Okay. Open a bit. Now hold your jaw steady and let me push on your teeth. Does that hurt?
Yeah.
Okay. And I'll move your jaw sideways. Does that hurt?
No.
Does that hurt? Okay. When I move the jaw towards the affected side, it hurts. Now, do you know which one of the teeth is bothering you back there?
I think it's the last one.
The last tooth on the upper or lower?
Lower side.
Okay. We'll put some articulating paper to check the occlusion. I won't be able to check it in centric relation because of the tenderness of the joint. Close down. Grit your teeth a little. Tap up and down. Move sideways a little like you're gritting. Does that hurt when you do that? Mm-hmm. Okay. Now if you'll open, see if we can find that contact. There is a light spot on the distal incline of the mesiolingual cusp. And that's about the only contact. You can see facets of wear on the tooth in addition to that point of contact. Close. Can you move towards me just a little bit with your jaw, please? A little more. More. It's difficult to tell whether she has a balancing interference or not because of the pain she's having when I try to move her jaw to the right. May I see how you hold your embouchure when you play the clarinet, please?
Do you want me to put in the guard?
Oh, you use this guard to play with?
This prevents me from cutting into my lower lip after a lot of practice.
I see.
All right.
Let's see what it looks like. Just a piece of acrylic over the lower teeth. How does that fit when you bring your back teeth together or try to? Opens a bite. Kind of keratinized along the front surface here. Now, how do you hold that when you're playing your instrument? Over the top. Well, since you have your clarinet here, you can show us how you use it.
Want me to play or just...
Sure, go ahead. Let me see with the instrument in now. Put it in. Go ahead and hold it like you hold it. Okay, just relax a little. See? Okay. Is your joint bothering you at all now?
Not right now.
Well, let's see how you play that instrument.
Well, it is a little bit over here.
A little bit sore on the right. And you maintain this position for long periods of time?
Yeah. Sometimes there is some jaw movement which there shouldn't be when I'm playing fast.
Mm-hmm.
And if there's a lot of tension.
And you had this before the most recent problem started with your joint?
I had what?
You had this device?
Yes, I did.
Yeah. As far as you know, that device doesn't relate at any point to the onset of your problems with the joint.
It may contribute to it. I'm not sure. It wasn't the catalyst, I don't think, initially. Possibly a larger mouthpiece has aggravated it.
You've had a change in the mouthpiece since you...
Yes, and it is much less comfortable. I have to open my mouth more with it. It seems to add more strain there.
Well, I think what we'll do for this patient is to treat the tooth as it develops, do some occlusal adjustment on it, to remove any trauma that might exist from her occlusion. We'll treat conservatively the joint problem, perhaps using a splint and later a occlusal adjustment. And if we do not get the response we would anticipate for these treatments, then we'll have to consider what effect this little device might play in perpetuating or aggravating the TM joint.
You've been listening to a presentation from the University of Michigan School of Dentistry, which is dedicated to supporting open learning and open educational resources. This recording is licensed under the Creative Commons. It may be reused and redistributed for nonprofit use. Please attribute materials to the University of Michigan School of Dentistry and redistribute under this same license. For more information on how this and other University of Michigan School of Dentistry recordings may be used, visit www.dent.umich.edu/license.